Hello, my name is Caitlin Comet. I am a program coordinator at the Hub, and I will be talking about the influence of COVID-19 on mental health and in particular in working parents. A little bit about us before we begin. The Hub is a division of RIASEP and your regional resource. We are the Regional Behavioral Health Action Organization, or RBHAO, of Region 1 of Southwest Connecticut. We serve as a strategic community partner and work across the behavioral healthcare continuum, and we are responsible for a range of planning, education, and advocacy of behavioral health needs and services for children and adults. If you'd like more information about who we are and what we do, you can visit thehubct.org. And if you'd like to contact us with any questions, inquiries, or feedback, you can email us at info@thehubct.org. We collaborate with stakeholders throughout the region. We work with many different individuals throughout our region in our combined efforts, and we are also responsible for facilitating the catchment area councils, or CACs. We also fund and support different towns in our local prevention councils, or LPCs. We facilitate the Region 1 Gambling Awareness Team and the Southwest Regional Suicide Advisory Board. One of our responsibilities is also to publish our needs assessment or regional priority report. We recently did this in 2020. The purpose of the report is to describe the current state of mental health, substance use, and problem gambling in the region, as well as make recommendations for the region and state, identify emerging needs and populations who need mental health and behavioral health services. So the primary purpose is to inform DMIS of the behavioral health needs of children, adolescents, and adults in Southwest Connecticut. We provide data and priority recommendations for prevention, treatment, and recovery. In order to publish our report, our process does include gathering data from primary and secondary resources, utilizing a data committee, a prioritization committee, and focus groups. The report is available on our website under data. When we have our priorities or topics, and these are a list of our priority topics, for each of these, we create an epidemiological profile or epi profile. So this is what it looks like on the right-hand side of the screen. There is an epi profile for every topic. And once we have our epi profiles, we conduct a prioritization matrix with a group of stakeholders to determine the ranking of priorities in our region for this time. So for our region, the ranking that we found is in order, with first mental health being the top priority, followed by suicide at second, and then third, alcohol. For each of these priority topics, we also create an infographic, which you'll see on the left-hand side of the screen. And these infographics essentially take out the highlights of each epi profile. And these are a little bit easier on the eyes and also open to be shared with anybody who's interested in knowing about a specific topic in our region at a specific time. The epidemiological profiles and infographics are also available on our website under data. But what's really important after our priorities matrix is that we found that mental health was the #1 priority above all other topics. Here is our mental health infographic for 2020. And again, these are the highlights from our epidemiological profile, but there is more detail about mental health in our region if you visit our website and go under data. So what we can pull out from 2020 when it comes to mental health is some good, and the good really came with telehealth, both for consumers and providers. For consumers, it was easy access to still get treatment through telehealth. And for providers or physician respondents, were reporting that they were appreciative and grateful for telehealth, as it did allow physicians and medical professionals to stay in touch with their patients despite the pandemic, and was able to see more of their patients more often. Some bad that did come out of this time when it comes to mental health is adults and young adults struggling with mental health, and really all age ranges struggling with mental health more now than ever before. 41% of adults had reported suffering from one or both of anxiety and depression, and this statistic has doubled compared to pre-pandemic findings. Young adults have been reporting the highest rates of major depressive episodes, followed by youth and then adults. Anxiety was the greatest mental health concern for youth at 64.3% compared to trauma, and then depression, and then suicide. Anxiety was considered the greatest mental health concern in 43.2% of young adults. Young adults are reporting serious mental illnesses or that the mental health was dismal. The most common mental health diagnoses nationwide are depression, anxiety, and serious mental illnesses, and these numbers have increased since the pandemic. So before we talk about the effects of COVID on our mental health, it's important to look at what was going on before the pandemic or pre-COVID. So mental health in adults pre-COVID, these statistics are from 2018 to 2019 and are from Mental Health America, SAMHSA, CDC, and National Institute of Mental Health, and NAMI. So 19.80% of adults experience a mental illness nationwide. 4.5% of Connecticut adults experienced a mental illness in the past year, and that was in 2019 pre-COVID. 11% of adults experienced depression and anxiety nationwide. More than half of these adults do not receive treatment. 7.1% of Connecticut respondents reported a major depressive episode in the past year. And again, this was pre-COVID in 2019. So we can already see that for many of us, we were already struggling with mental health challenges and mental illnesses. And then came the pandemic and came COVID. So with already struggling with those mental health challenges, there was now a lot of different factors that came with the pandemic that really exacerbated these symptoms. For example, a heightened fear of illness and getting sick. Our everyday routines, our productivity was disrupted. So despite us being creatures of habit, our everyday routines were now disruptive. With productivity, many of us were now struggling with what to do or juggling too much to do. We also were isolated and lonely during lockdown, especially with mandatory social distancing, not being able to see loved ones, not being able to visit loved ones, for example, in our senior living communities or in hospitals, really having a distance between those, between ourselves and those that we care about. And on top of that, many of us had lost so many individuals in our life, and we were really grieving together as a society during the pandemic. For those that were now had to switch to online schooling or graduated online, whether you're a student yourself or you suddenly became a teacher in some ways for someone else. Some of us had limited access to healthcare in a time where we needed it maybe more than before. And this is for mental and behavioral health. Many of us experience unstable housing and food insecurity. Other factors included job insecurity and economic insecurity as unemployment rates increased drastically. Our health and safety, now being more concerned about this more than ever before. Something as simple as a grocery trip was now very anxiety provoking and challenging. The sandwich generation refers to the generation taking care of an elderly loved one, perhaps a parent or grandparent, as well as taking care of children. So really the in-between generation balancing, taking care of everyone else, including ourselves, and balancing all of these responsibilities. With parenting, a lot of anxiety and expectations, feeling like you have to balance all of this and still feel like you're doing a good job, you're a good parent, or balancing the fear of being judged and the expectations of yourself and others. Single parents and caregivers taking on a lot of responsibility already, and now even more so during the pandemic. Postpartum depression and babies born during COVID. So a lot of parents and children were struggling during this time with postpartum depression or even having a pregnancy during COVID and giving birth. And on top of our own mental health, also trying to look out for our children's mental health as they are experiencing a lot during this time. With all that being said, here are the numbers post-COVID, after COVID, and even still today of mental health in adults. Again, these resources are from this past year from Mental Health America, SAMHSA, CDC, National Institute of Mental Health, and NAMI. Many adults were reporting that COVID impacted their emotional being above everything else in the worst way. This is even compared to physical health and financial security. So in the past year, 18.85% of adults experienced a mental illness. 41% of adults reported anxiety or depression nationwide. These numbers already are doubled pre-pandemic. In the past year, 4.46% of adults experienced serious thoughts of suicide. Suicidal ideation has increased in adults, substance use has increased, and essential workers became a high-risk group. So with everything on top of COVID, there's also our typical stresses and anxiety that we deal with as parents. So mental health, behavioral health problems were always prevalent in our society. COVID-19 certainly exacerbated these symptoms. When it comes to working parents, there are really unique factors specific to parents and even so working parents during this time. For many working parents, it might feel like there are not enough hours in just one day to get work done, or that we even need to duplicate ourselves just to be able to keep up with demands. There are a lot of high expectations on working parents as they do possess many roles and responsibilities. So just like mental and behavioral health, working parents have always struggled with balancing life, but COVID made this more difficult. Working parents were thrusted into navigating working from home, or working on the front lines, or being an essential worker, now taking care of their children full-time, often helping with online schooling, becoming teachers in themselves in some ways. Childcare was now disrupted, taking care of the home and the space, and on top of all of that, attempting to take care of ourselves. So balancing work, childcare, household chores, personal care, trying to be a perfect parent, a great role model, a loving and attentive partner or spouse, and a successful worker. It's quite a lot that we do have to balance when we are working parents. On top of that, we are also concerned about our child, our children, our children's mental health. Kids in Crisis of Fairfield, American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association has declared a children's mental health crisis that we are experiencing. These numbers and reports are from DCF, our own priority report, and our key informant focus groups, local youth surveys, and Connecticut school health surveys. We are seeing an increase in anxiety, depression, and ideation in our children and our youth. Emergency departments are feeling overwhelmed, and this was intensified during the pandemic and even right now, especially with individuals struggling with suicide ideation and food disorders. There are high numbers of physical and emotional neglect. Many have declared a state of emergency. So again, and this is also with unique factors, including family conflict and mental health. There has been an increase in crisis helplines. There are many children that are feeling disconnected after the pandemic and having trouble adjusting. And then the children who were born during COVID are definitely going through a very different circumstance than most of us were used to. So with all of this going on, if a caregiver is highly stressful, there might not be enough space to be emotionally invested in their children. However, parents are showing more concern for their children's emotional well-being now than before, but do often underestimate the severity of mental health challenges and substance use in children and young adults. With all that being said, a lot happened during COVID, and there was some good that came out of this time. While the pandemic did affect us in overwhelming ways, there was a lot of great things that came out during the pandemic and even now. During this time, we see an increase in understanding and awareness of mental health as we were all struggling. And with this, the increase in visibility Many of us are connecting over the struggles and challenges that we had during and after COVID, and conversations around mental health began to happen more frequently. So we begin to see the starting and continuing of community conversations. There was an increase in the use of mental health mobile crisis services, hotlines, and warm lines, as well as an increase in individuals utilizing resources, trainings, tools, and mental health professional help. So it's really great to see more individuals receiving help. And because of this demand, there is an increase in more attention in making these services more widely available. We also see online accessibility to health and mental health services. For example, with telehealth, it was easier to tune in, to be able to attend different meetings, to attend different support groups, to be able to receive mental health or behavioral health services online. With this being said, there were also just more online opportunities to be able to attend different events or panels or trainings, support group meetings, even if you weren't able to do so before. So it was now easier to tune into somewhere from the safety and the comfort of your own home. We also see an increase in resiliency. So because we all went through such a hard time, our strength in resiliency has increased in our ability to adapt to adversity and our ability to adapt to life challenges and overcome these with healthy coping skills. Even in our children, we see them able to now be able to talk and process through things, learn how to prioritize our time, manage our responsibility in healthy ways, healthy coping strategies, having honest conversations, and the ability to empathize and connect with others. We see this in our community connection, telehealth services, as I've already mentioned, and many children are ready to talk and many parents are ready to listen. So a lot of children were reporting that they want to talk about what happened during COVID, that they really want to process what happened and they are willing to do so with parents or caretakers or even an older mentor like a teacher or a doctor or a mental health professional. With that being said, a lot of parents are also reporting that they do feel concerned for their children and are wishing to have these conversations. So again, many kids are ready to talk and many parents are ready to listen. There's a lot of good that came out of this because now we know how to be there for each other. Something as simple as asking, how are you really doing? And taking the time to be there for one another can be really life-changing in each other's lives. Something as simple as sharing just one resource that you know with others can be life-changing and it can make a significant difference and improvement in others' well-being. Just to take a step back to our priority report, when it comes to our priority report, we did put in recommendations on a wider regional level based on the data that we gathered, as well as our key informant focus groups. So when it comes to mental health and suicide and prevention, we want to be able to provide more mental health and QPR trainings for educators and also more mental health first aid trainings to the community at large. So we are all equipped with how can we take care of ourselves and each other. We want to be able to coordinate and implement more awareness campaigns focusing on stigma reduction and conversations around suicide, and encourage towns to create a suicide postvention planning team. So again, these are recommendations for the region and in some cases for the state in how we can all be better. When it comes to treatment, supporting regional efforts to address timely access to treatment, including access to medication. So for example, open access models, telehealth, cooperative agreements among providers, evening and weekend hours, and co-locating clinics at shelters. Expanding and offering services and resources such as bed availability and crisis mobile lines during late night hours and weekends. At the Hub, we have a lot of wonderful resources for the communities in our region. Firstly, our resource guides. Our resource guides cover our region. There are two to separate the upper and lower parts of the region. These are available in English and Spanish and are for providers and consumers. So anybody is able to open up our resource guide and look at a list of different services in the region, utilizing our key to find what best works for you, and contact information. We update these often, and we directly do call the sources to make sure our information is updated and that we provide the best contact information. These are available on our website as a PDF with hyperlinks that bring you directly to that organization, or you can request free materials from us and we will give you our resource guides as booklets. We also have a list of free peer support groups in a booklet. So if you're looking for anything or a range of different mental health topics, you can go to our list of free peer support groups and find a support group for that mental health topic. These are updated frequently as more information and updates are happening every day. So again, this is also a PDF on our website that has hyperlinks, or you can request physical copies in booklets. We do also have Spanish resources included in this booklet. Our website is a huge resource of information. We are, exactly as our name says, the hub of information, resources, and services. We compile everything to make it easier to navigate services for yourself in the region or for someone else. When you do visit our website, it can seem like a lot of information, but we do try our best to organize it in the best way possible. We have wellness, prevention, treatment, and recovery pages that are frequently updated. We have a newer COVID-19 page with resources specific to COVID-19. Our Mental Health Month 2021 page was so popular and loved that we decided to keep it. May is Mental Health Month, but we kept our page because it has a lot of great mental health resources and information. We have a new LGBTQIA+ page on our website of compiled information and resources for individuals in the LGBTQIA+ community. We have our calendar of events that has events happening at the hub, our trainings, our free trainings, whatever lunch and learns we have, as well as some events that are happening with our meetings, like our LPC meetings or our CAC meetings, our Regional Suicide Advisory Board meetings, problem gambling meetings. You can RSVP to our free trainings on our website if you do go to events, or rather calendar, and then events. We have our data tab, which has our priority report, our epidemiological profiles, and our infographics. You can order free products and materials, get to know who we are, and review our mental health blog. At the hub, we create a lot of different handouts or flyers, infographics with compilation of information and resources. Here is an example of a mental health one that we have. This can be used for yourself or you can share it out. But for example, this one includes some important information, some crisis and warm lines. And if you do want more resources, these are on our website. We have a lot more that are like these. This is another example. If you go on our website, you'll see different resources available out there. For example, Reach Out Connecticut or Kids in Crisis, different crisis hotlines. And then we compile this information for you. For example, in our Connecticut Crisis Support flyer, and we have this available in Spanish as well. So these are options to go with 211 instead of just knowing 211 as its only resource, but there are options that also support 211 and can go along with it. We also have a weekly newsletter that is a great source of information. There's so much that we share out every single week, highlighting efforts, blogs, articles, upcoming events, trainings, updates about us and others in the region, and more. If you or your organization has something happening that you want to boost visibility and send it out to the region, you can send it to us and we would be happy to share it out. Or if you're just interested in knowing what's going on in the region and stay up to date, our newsletter is a wonderful way to do that. So if you go to our website, scroll all the way down, you can subscribe to our weekly newsletter. These are some examples. We recently had the emotional wellness in children and teens, social and emotional skills, resources for families, the psychology of coming out, post-traumatic stress disorder, PTSD can affect anyone. So we do have our newsletter and our blogs that cover a wide range of topics for all age groups. And again, on that continuum of prevention, treatment, and recovery. We are also very active on social media, posting multiple times throughout each day. We have our Instagram, Twitter, and Facebook, where we have wellness posts, upcoming events and trainings, social media takeovers, and more. And these are some examples of wellness posts that we have posted. In addition to all of this, we also have free trainings open to the community and groups. If your group or team or organization wants a specific training for you, we can do that. Otherwise, we do have Narcan trainings twice a month, as well as QPR or suicide gatekeeping, question, persuade, refer trainings twice a month that are open to the community. These are free, and if you do take our free Narcan training, you'll get a free Narcan kit. So if you're interested, you can RSVP on our website or email us if you are interested in a group-specific training. And finally, I'm going to end with some resources that are specific to families and working parents and mental health. There's a lot of wonderful resources. You can look up these resources, or if you email us, you can get a copy of these slides. And all of these resources have hyperlinks in them in our PDF. Here's a list of our quarterly meetings, our LPC, our CACs, Regional Suicide Advisory Board, Region 1 Gambling Awareness Team, and a lot of different lunch and learns that we host throughout the year and in our region. So everyone is welcome to join these and to get involved in your community, to give back, and also to be updated in what is happening. And with that, thank you so much for your time. Here's our contact information, our program director, Giovanna Mozo, my fellow program coordinators, Daniela Arias and Victoria O'Neill. Thank you so much for your time, and I hope you have a wonderful day.